Hi everyone, my name is Charmaine and I'm the dietitian that helps people reverse type 2 diabetes with plant-based eating. And I have Galia with me today.
Hi everyone.
Awesome. And we are so excited to record another podcast for you guys. And this week we are talking about the complications of diabetes and mostly on how we can reduce the risks of these complications and even reverse some of them as well. So I'm very excited about this because I think what our mission here in helping people reverse diabetes is really to deliver hope for people, not to instill fear in people. So we really wanted this podcast to be able to instill hope in you, even though complications of diabetes can be really scary. We do want to show you what are the scientific evidence that can really, help us know, okay, what kind of eating lifestyle can reduce these risks and complications. So very excited to speak about this. And Galia, wanted to know why you're interested in speaking about this as well.
Yeah, so this idea for this podcast actually came from a conversation with a client who's in the program with us. In a conversation that we were having, she felt a lot of hope by having that reassurance of any kind of change towards having a more plant-based lifestyle was going to have a positive impact on her body, right? And I think a lot of the time there is, when you have that fear of those complications, it can feel like a lot of pressure. And a lot of the time that kind of lends itself to you sometimes feeling like you're not doing enough, right? And being really self-critical and getting down on yourself. And so her learning about how even small changes in, her eating patterns, moving towards being more plant-based progressively, was a positive change, right? And it really stopped. The more she learned about, the kind of science in how a plant-based diet can help her, right? The less critical she felt about feeling like she had to be 100% compliant, because she knew the evidence behind even small changes are going to, have a positive impact. So I think, this is really for her. She really wanted more information, and she felt like, us doing this was going to be really helpful for other people out there as well. So this is kind of shout out to her. Hopefully she's listening to this as well. Hopefully we can pass on, like Charmaine said, that hope to you guys, and have you feel reassured on, any change, even if you think it's a small change, it's going to have a, positive impact for you and in your life.
Yeah, absolutely. And, I want to touch a little bit on that and, how you don't have to do 100% plant-based to really see results in this. And I know you quoted some studies earlier in our discussion about this. And would you like to share with everyone what the studies show and, how when you progressively go towards more of a whole unprocessed plant-based lifestyle, how it helps people in reducing risk of complications?
Yeah, absolutely. So like one of the biggest studies, so like all of the information that we're talking about today, I got from like one large research paper. So they're quoting multiple different studies, different like series of meta-analyses. So there's so much valuable information in this study. And if you guys are interested in it, you can always reach out to us and I can send you the whole paper if you guys want. But one of the biggest studies that kind of looks at reduction in risk in a stepwise fashion as you move towards adopting more plant-based nutrition. And this study is the Adventist Health Study 2, and it looks at 61,000 people, right? So this is a huge study. And what they found is that as you move towards adopting a completely plant-based diet, obviously not everyone is going to want to do that, right? But this is what we're saying about even those small changes, right, are going to have a positive income at reducing your risk. So we see risk drop down massively to 2.9% in people who are completely plant-based, right? But even somebody who's lacto ovo vegetarian, so people who still have eggs and dairy, right? They have a 3.2% risk. So you can still have that flexibility, right? If you're someone who enjoys cheese, I'm someone who enjoys cheese, right? You can have flexible meals on the weekend that have some dairy in there, right? And you're still working towards reducing your risk. And so I think this really provides a lot of hope for people to know that you can gradually transition. It doesn't have to be like an overnight change, for you to work towards reducing risk of complications and ultimately reversing your diabetes as well.
Yeah, I love that. And, just to be transparent with everyone, I know when I say a plant-based diet, people will think like, oh, you're trying to make me go vegan, or you're trying to make me go, without meat. And I would just like to say this here. And I actually, have said this in a TikTok video. I've said this to my client that, I don't call myself a vegan because you know what? Like I do have meat like once in a while, for example, on my birthday, I had ham and cheese in Spain because, I heard it's really good and I had it, I enjoyed it. And I really want people to know that this is not about, not eating animal products or, it's really about actually changing your lifestyle where it is conducive to your insulin sensitivity, where it's conducive to your heart health, to your renal health, to, every area of your health. And it's also really about having balance too. So that's definitely something I really want people to understand. And when talking about complications, we all know that, if you have worse indicators, for example, like blood sugar or A1C, it increases your chances of getting these diabetic complications, right? So a lot of times doctors, protocol to help people reduce risks of complications is to give diabetic medications. Even if someone just has pre-diabetes, or even if someone just has PCOS, if they have insulin resistance, even though their A1C is not high yet, I know doctors, protocols to give metformin right away. And so we see that a lot, but I'm just curious on your thoughts, Galia, on why just controlling these indicators is not enough in preventing diabetic complications.
Right. I think that's a really good question. And it's really valuable to kind of speak about that with people and elaborate on that. So like in terms of how complications arise, diabetes complications arise very gradually and at a baseline are attributed to glycemic variability and chronic inflammation, right? And so the issue with just relying on medication is that it kind of can feel like, for lack of better articulation, it can kind of feel like an endless battle, right? Because you're not addressing the root causes, you're not addressing the issue at its base. And so because lifestyle modification, changes in lifestyle are not suggested or implemented, it just becomes this story of progressively more and more medication being added and it being harder to actually have a A1C that's in range, right? And low glycemic variability. So what I mean by glycemic variability is those ups and downs, right? And typically the more medication you have factored in, the more difficult it is to have that kind of stability. And that's what really causes these microvascular complications. So something known as endothelial dysfunction occurs because of this glycemic variability, because of high inflammation, elevated reactive oxygen species, right? They affect the endothelium, which is this cell lining that is responsible for the way kind of blood molecules move around in our system into our organs, right? And so the way that we reduce chronic inflammation, the way that we can reduce the amount of reactive oxygen species in our diet is not by medication, it's by what we eat, it's our lifestyle, right? And so really focusing on that. And over time, I believe the healthcare community is becoming more and more aware of this, because even though people have a controlled A1C on medication, right, we're still seeing people have a very high rate of complications. And so it's important for us to talk about, okay, how can I reduce that risk? How do I reduce the inflammation, the level of reactive oxygen species, the insulin resistance, the endothelium damage that I'm experiencing? That's through lifestyle change. And so there was this other study that was done that looked at 99 people and a huge kind of age span from 27 to 82 years old. So a really good kind of scope of the population. And they compared, a plant-based diet to the like standard diet in the US, the American like Diabetes Association recommended diet. And what they found was that the people who are on a plant-based diet were able to reduce their diabetic medication at a greater frequency than people who were on that standard diet, right? So people on a plant-based diet were able to reduce, 43% of people, were able to reduce their medications compared to 26% of people on that standard diet. So it really tells you how much more effective that diet is at promoting overall well-being in terms of reduced A1C, in terms of reduced body weight and reduced cholesterol as well, which is a risk factor. So, I think it would be helpful to talk about like why do we see that level of change on a plant-based diet compared to these standard prescribed diets, right? Like, why is it that a plant-based diet is so effective in terms of what you get from it, right, at reducing metrics, promoting overall well-being? So Charmaine, you're really the expert on that, so I'll hand over to you.
Yeah, absolutely. And I just want to, respond on how when we have a lot of different medications, and that's actually something that we talked about in our last podcast about polypharmacy, that itself is another complications when it comes to diabetes, because, in polypharmacy, the drug to drug interactions, the food to drug interactions, it causes a lot of problems, and it does cause a lot of hospitalizations and even mortality as well. So that is why we are so passionate in helping people actually get off medications and really rely on lifestyle change instead. And, I like to have our audience think about this. There's, let's say you go to a pharmacy shop, right? And there's this different medications for, maybe this is for cough, this is for flu, this is for COVID, this is for heart disease. You get to choose a lot of different medications for each ailment or each disease, but there's not one that will help everything, right? And then the thing is, like, each potion or each, medication, I like to use potion in this analogy because I think it makes things more magical. But, you can choose each potion for one ailment, but it actually causes another disease. And, of course we don't want that. But what plant-based lifestyle is that one special potion that helps with almost everything, with your heart disease, with renal health, with neuropathy even, and with retinopathy. It really does help with everything, but it's not something that you buy, it's something that you put in your mouth, something that you eat. So definitely really passionate about this, and I would love to dig deeper into the different areas and different complications of how a plant-based diet can help alleviate them. So just to outline the different complications that we do want to address, one of them is cardiovascular disease, that means heart disease. One is renal disease, that's a really big one. A lot of people with type 2 diabetes have to have dialysis. So how do we prevent that, right? Neuropathy, neuropathic pain, like retinopathy. Retinopathy means, neuropathy in your vision, how it affects your eyesight. A lot of people experience that, or people that have family members that have diabetes are very familiar about that. So these are the things that we want to cover today. So let's talk about cardiovascular disease first. So cardiovascular disease, let's say, I'll say heart disease just to keep it short. It's a shorter word. But that's actually something that I want to say is the easiest to reverse with the plant-based diet, because we have experience in helping over 300 people reverse their diabetes. And what we've realized is their cholesterol, their triglycerides is usually the first to go down, even within days of starting this lifestyle. And so with cholesterol and triglycerides, we all know that is directly related to heart disease. And with a plant-based diet, because it is so high in soluble fiber, it's high in fiber, it's low in saturated fat, and most of the time it is lower in fat as well. So it actually is really beneficial beneficial in helping people actually reverse their heart disease, lower their risks of having heart attacks, and just to really improve their heart health. And a lot of times with diabetes and heart disease, that's actually one of the biggest correlation that they have. A lot of times people who have diabetes do have heart disease, but the good thing is not only does this reduce your heart disease, but it also reverses your diabetes as well. So, which is very exciting. I don't know if you want to add on to that, Galia.
Yeah, I was just going to add, like, based on, the studies that we've been looking at. So like what I think is really interesting and what gives a lot of hope to like people at every kind of stage, right, is that a plant-based diet is preventative, but it's also a fantastic intervention depending on where you are, right? So plant-based diet is preventative of heart disease for the reasons in which you shared, right? It's like it's a diet that's low in saturated fat, doesn't have excess cholesterol in the diet, right? So it's really reducing those initial risk factors. But a plant-based diet has also been shown to be a very, very effective intervention for people who have signs of coronary artery disease, right? So it's been shown to actually backtrack, right, the state of your arteries and improve your cardiovascular health. So I think it's great because it tells you that no matter where you're at, right, making any degree of change towards a plant-based diet is going to improve where you're at in your health. And I think that's absolutely incredible. And it's just a testament to how effective this lifestyle is, like I said, at any level of adoption, at improving where you're at in your well-being.
Yeah, absolutely. And one more thing too is it's interesting because I think about how when we talk about, okay, let's say we're having a conversation, so-and-so has heart disease. Oh, going plant-based will be really good for him. I think it makes sense in a lot of people's mind because we all know, okay, red meat, like eggs, it's, they're high in cholesterol. It's not good for heart disease. But then when it comes to diabetes, we're like, oh, a plant-based diet, that's too much carbs. It's not good for diabetes. So I think it's interesting because I think we have a lot of duality in terms of what different diets for different disease. But the truth is, a whole foods plant-based diet is good, not just for heart disease, but also for diabetes as well. And, some of the research that the scientists have found is also the level of inflammation that plant-based diet can reduce when it comes to, biomarkers of inflammation, right? In heart disease and even in diabetes, inflammation is very, very important as an indicator for us to control. And actually, I don't know if you want to add a little bit on that, Galia, on how research have shown that the plant-based diet is really good for reducing chronic inflammation.
Right. Yeah, 100%. So one of the top markers that we look for to gauge chronic inflammatory state in the body is C-reactive protein. And so any level of adoption in a plant-based diet has been shown to lower that C-reactive protein. And I mean, I think most people are aware that inflammation is kind of the starting point for a lot of health issues, or not just in terms of complications, but just how you feel, right, on a day-to-day and how your body operates. And so I think that is a fantastic indicator that shows you, that can quantify, right, like how useful this way of eating, this eating pattern is at improving where you're at in your health and your well-being.
Yeah, absolutely. But one thing I really wanted to talk about is also our renal health. A lot of times when people have diabetes, because of the high blood sugar, it does affect their kidney health a lot, especially because, when it comes to our kidney, it is a filter, kind of like a filter for our body, right? It filters out our blood. And so a lot of times because of the high blood sugar, it damages the nephrons in the kidney, which affects our kidneys filtering function, if that makes sense. And that's why a lot of people end up on dialysis because of diabetes. And this is something that we really want to not only help people understand how a plant-based diet can help reverse diabetes, but also help improve your renal health as well. So of course, with if you've listened to our podcast for a while, you know that plant-based diet can help improve your insulin resistance and help you lower your blood sugar, which in turns, reduces the damage on your kidneys. But at the same time, actually a plant-based diet is really, really beneficial for your kidney health. When I was a baby dietitian, I remember going to this plant-based conference, and I was speaking to this renal specialist who's also a dietitian as well. And she was telling me, honestly, the best diet for kidney health and renal health is a plant-based diet, because it has way less burden on the kidney. It has way less acidity in terms of the burden on the kidney. And it's very, very beneficial for people to actually try to regain their kidney function. And so that was really eye-opening to me, because I think in the traditional dietetics industry, we're taught, okay, if that person is on dialysis, we need to be careful about potassium, we need to be careful about phosphorus, and a lot of plant-based foods are very rich in those minerals like potassium and phosphorus, right? And so a lot of the mainstream dietetics approach is to limit those foods that are high in potassium and phosphorus. And of course, we're not saying that, just go ahead and eat a bunch of bananas and potatoes right now, but it's really about, again, going to the root cause. Let us help improve your kidney health first. Let us help you improve your body's filter first, so that you can eat these foods, right? Because at the end of the day, phosphorus, potassium in potatoes and bananas is actually beneficial for you. But what's happening right now is your kidney having problems in processing those foods. So let's focus on improving your kidney health first. So I think that's really cool. Plant-based diet is also really good for helping people, not only preventing dialysis, but also improving the outcome of dialysis, and even in kidney health as well.
I love that. And in terms, again, just to give you guys the numbers based on research that we've looked at. So one of the studies that I found essentially concluded that a 33% adoption of a plant-based diet correlates to 23% lower risk of renal disease, of getting onto dialysis, right? Of any of those kind of clinical complications that might arise. And the correlation of, or the findings of how useful a plant-based diet is both observational and interventional. So that is found in terms of people who follow a plant-based diet are less at risk of renal disease, but also in terms of interventions, right? So when your renal function is tested and it's suspected that it's starting to decline, right? Using a plant-based diet as an intervention can help preserve the state of your kidneys and can also improve, where you're at. So again, moving towards talking about this in this podcast as a plant-based diet offers a lot of hope in terms of wherever you're at, right? A plant-based diet at any level of adoption can improve where you're at.
Yeah, absolutely. I love that. And let's talk about neuropathy. I think that's a big thing for a lot of our listeners, is neuropathy and neuropathic pain. And I actually made a TikTok yesterday about that. And so a lot of times, so what is neuropathy? So neuropathy is basically, a condition where high blood sugar damages your nerves. And so it can be of different levels. Sometimes it can be, a microneuropathy. Sometimes it can be, pretty serious. But one thing that I want to touch upon about neuropathy is how a plant-based diet can actually not only relieve neuropathic pain, but also help regress neuropathy. So there's a study called The Effect of Rice Diet on Diabetes Mellitus Associated with Vascular Disease. And this one is really interesting because when it comes to, what the study did is they gave patients rice and fruit. And a lot of people would think, whoa, this is a recipe for disaster for people living with diabetes because it's so high in carbohydrates. It might spike your blood sugar and worsen the blood sugar levels, which will be horrible for neuropathy and retinopathy, so on and so forth. But they actually realized in this study that they actually helped people regress their retinopathy and help them improve their blood sugar outcome. And so I think that's really telling, because I think a lot of times people will think, well, a high carb diet is not good for reversing diabetes or good for, managing your blood sugar, but it actually, if anything, it helps your blood sugar, and it actually regressed the progression of neuropathy, which I think is really exciting. And I think why this really happens is when you see someone with a really high carb diet, why is their blood sugar lowering? And it's because we're actually helping people reverse the insulin resistance, which helps them be able to process these carbohydrates way better than ever before. And that's the reason why it really helps people not only lower their blood sugar, but also help them regress neuropathy and also relieve neuropathic pain as well. There's actually another study that showed that a plant-based diet, they actually had people live in a facility, and they just gave them meals, and it was 21 people, and all of them experienced neuropathic pain, and they've had diabetes for years. But as the study progressed, 17 out of 21 patients actually reported complete relief of neuropathic pain in just 4 to 16 days, which is so impressive. And I think that just says a lot of what a plant-based diet can do in helping with neuropathic pain and also reducing neuropathy as well. I really wanted to let you guys know we're just really reaching the tip of the iceberg when it comes to the research, the overwhelming amount of research of what a plant-based diet can do in helping reduce complications and improving your health, in reversing diabetes, reversing heart disease, and improving renal health, improving neuropathy. We're really just touching the tip of the iceberg. But if anything, I want you guys to know how powerful a plant-based lifestyle is, not just in diabetes, but also in your heart health, in your kidney health, in your liver health, in every area of your health. So we really want to touch upon that. And if you're interested in working with us in reversing your diabetes, make sure you click the link below to apply to work with us in our reversing diabetes system. Or if you haven't finished the free training, make sure you finish the free training that we have on how we explain how we've helped hundreds of people reverse their type 2 diabetes and get off medications. And we really truly feel like we're doing something big here. We're on a mission to change the atmosphere of diabetes and of the way that we eat. So thank you so much for listening, and I'll talk to you guys soon. Have a good one.